Hello, welcome to our first webinar. This is our first time using this software too. So I'm hoping you'll teach us the strengths and weaknesses of this approach. First, if you would please, as you come on, if you write in the chat box, that's a little blue box in the upper right corner, um, type down things that you would like to learn from this webinar. For example, it doesn't necessarily, today's webinar is about oral hygiene after you've had initial treatment. But if there's other things, say that you've had other type of periodontal treatment or implants or whatever it is, regardless of what it might be, um, don't hesitate to either send me a question. There's a question box to the right-hand side of your screen, at least it's the right-hand side of my screen. And there's a chat box. The very top box is the chat box. So you're welcome to hit that button and type anything you want me to read, anything you want me to see. If there's something in particular you would like to know or get out of this webinar today, please type that in there. If there are questions in particular, type it in the question box. And let's try to make this as much interactive as we can. Today, I'm really focused on, I get these questions all the time. You know, you've just had a pinhole surgery to correct your recession, or you've had a bunch of implants placed and now you've got your final restorations in. And how do you maintain it? Oh my gosh, you've invested in your smile. You've put time and money and effort into receiving the care that you've had so far. And now, gosh, you want to keep it, right? You don't want it to deteriorate. You want to maintain it as long as you possibly can. And the cool thing is, with good oral hygiene, the right techniques, just about everything we do, it can be maintained for life. You can maintain your teeth for life. That's not it doesn't matter if you've had gum disease or advanced recession or you name it. Once we've treated you, it technically, patients, I've been doing this 32 years now, and I've got patients who have maintained their work over that entire time span. And so just things to think about. This is doable. Let's see if I can switch. There's lots of gadgets on the market today. And so I know when I go into Walgreens or CVS or Walmart, you name it, just wherever you go to look at new brushes and things like that, there is just all sorts of stuff that you can buy today. I mean, there's just tons of stuff. And not only that, when you're on Facebook and these other types of social media, you'll see ads for the latest gimmicky type thing that's available on the market today. So I think we need to think about what really works in terms of post-care treatment too. And some things are deleterious, meaning there are some things that can actually harm the work that you've had done. So you want to avoid that stuff. So I'd like to think of, when I'm doing my treatment for somebody, I always like to know my outcome before we get started. So success begins with the end in mind. And I think the most important thing to think about is how to maintain it after you've had it done. For example, everybody's seen lots of commercials where you get teeth in a day or something like that. Most of those restorations, not most, but a great many of those restorations have a high failure rate because they're not cleansable. And so if you were to Google long-term outcomes for so many of these different types of treatments, lots of patients get gum disease around those teeth in a day type restorations because those restorations were never made to be cleansable, where they can be. We use a technique called Hybridge today. And the reason we use it is mainly because you can maintain it long term. It's cleansable. It's something that you can use and function with, not just for a few years, but the rest of your life. And I think that's important to think about too. Even if you've had recurring periodontal problems in the course of your life, there are ways to maintain things. And there's different steps, different stages that we can take to make sure that a patient maintains their teeth or their implants the rest of their life. I'll introduce you to my staff. We've got such a great staff. I mean, they've been with me for a long time, or many of them have. To my on one side of my photo that you see right there is my wife, Jackie. The other side is our new associate, Thomas. Dr. Wynn has started with us. He's been with us about a year now. I got to tell you, he's a wonderful periodontist. The staff behind me, I'm sure you've interacted with many of them through the phone or over the course of time. I got to tell you, everything we do is the result of a group effort. There's no single one thing that we do that is not improved because we're such a well functioning group. So let's talk about taking care of your teeth now. And it's not quite like, if you would go back and look at the history of taking care of your teeth, they would use the hair from pigs and put that on a wooden handle, and you'd have this really hard, stiff brush. And you think, well, a really stiff brush would clean up great. Well, just the opposite. A really stiff brush, a hard brush today, it doesn't really clean in between the teeth well. And in fact, there's a happy medium. Medium not being the happiest part, though. A medium soft brush or a medium brush is still too stiff to really clean in between teeth. When you're shopping at the store, you really want a soft toothbrush. After surgery, we put patients on a super soft toothbrush, and that's too soft for long-term use. So it turns out it's there's a just right point. I would tell you that since I've been in practice, water picks have been on the market from, I guess, the last 30 plus years. And I've never been a huge fan of the water pick before recent times. And the main reason is if I would do a regenerative procedure or soft tissue procedure, and you take a free-handed water pick, you typically aim it down at the gums or up at the gums, depending on which arch you're talking about. And the pressure from that water would actually cause the recession to reoccur, or it would blow out the tissue that I just regenerated. So I was never a big fan of water picks in the past. And yet I'll tell you today, they've got the best device on the market. So times have changed. So let's take a look at what is available today and what we've seen that works over time. First of all, a regular soft toothbrush. And I'm not so big on the brands. I think Butler makes a good one. Colgate makes a good one, but there's tons of good brands. You really just want a good soft toothbrush. And the key thing when you're using a toothbrush is the motion that you use. If these are teeth, and I want you to go up and down over those teeth, never in a saw motion. The saw motion, like you're using a saw, has that impact on your teeth over time. A saw motion can cause notches at the necks of your teeth. It can cause your gums to recede unevenly. It can abrade your teeth. So you want to stick with a soft brush and only up and down or slightly scrubbing motions, like an oval, but not a saw motion. That's just so important. The other thing is when you're holding your brush, you really want your brush just perpendicular to your teeth. We used to have techniques where you'd angle the bristles up, or you'd angle them up on the top teeth and down on the bottom teeth like this. And those are fine. Actually, they work, but they add such a complexity to it. I think people didn't follow through with it. So just keep your brush perpendicular. Keep the bristles perpendicular to the surface of the teeth. Go up and down or in a slight scrubbing motion. And then the other thing is not to palm the toothbrush in the whole palm of your hand, but to hold it in your fingertips. We see so many patients that brush so hard that you can brush hard enough to actually brush away your gums. You can make them too clean. So hold your toothbrush in the tips of your fingers. And that way you can't put as much pressure on it. And you don't really need a really hard pressure to clean in between the teeth. You just need a consistent scrub motion going up and down. And lastly, or not lastly, but the next thing on there is floss. Floss is in the newspapers over the last several years. I've seen newspaper articles that show that, you don't need to use floss. It's not as effective as we thought it was. What's funny about looking at those types of studies, though, or those types of reports in the newspaper, is there's studies that occurred over 10, 20, and 30 years where they compared patients that used floss and patients that didn't use floss. And guess what? Floss works. Um, so I'm still, if you're willing to floss, there's nothing more effective on the market than the manual technique of using a soft toothbrush, using it up and down, and then using floss. Floss does work. And then finally, after you floss your teeth, you need to rinse your mouth. Um, I've seen some interesting studies lately too on, oh, you shouldn't be rinsing your mouth with mouthwash because it'll mess up your biome in your gut. You know, it might mess up the biome in your mouth a little bit, but the studies have shown that it tends to lead to the type of bacteria that are non-motile, that breathe air. And those are the kind of bacteria we want in the mouth. So as long as you're rinsing your mouth, if you don't rinse your mouth, you typically leave more motile bacteria, bacteria that can move, and more bacteria that breathe CO2. They're anaerobic. And both of those types of bacteria are bad for your gums. So I'm still a big proponent of rinsing your mouth, whether it's with a mouthwash or just water. You're always better off just rinsing. This toothbrush right here is the Waterpik Sonic Fusion. And I got to tell you, I think we've been advocating a Sonicare toothbrush and those types of toothbrushes for years and years and years. This one has come on the market, I guess it's been a year and a half now. And I haven't seen anything more effective than this Waterpik Sonic Fusion. I'm a big fan. I've got a video. I'm going to see if I can play it now that I'm playing with our software. Let's see if I switch to it. Nope.
Hello, Julie over here at Fort Bend Perio. Today I was just going to talk to y'all about using this.
Okay. And back to that. I'm going to try sharing my screen and seeing how this works. I'm not able to play it so easily. Share. Okay, let's see if that's working for me. It says I'm currently sharing my screen. Let's see if that plays. All right. So let's watch it on this. I'm sharing my screen with my other computer.
Over here at Fort Bend Perio. Today I was just going to talk to y'all about using the Sonic Fusion. The most important thing about using the Sonic Fusion is making sure that the water pressure is not up too high. You do that by turning this knob over here on the left side to a 2. A 2 at the very most. Any more than that could damage your gums. The next part of using the Sonic Fusion is filling the reservoir. You want to fill it with water and then 2 cupfuls, medicine cupfuls of any of your favorite mouthwash. We recommend the Smart Mouth Rinse. It really helps to kill the bacteria. And then you're ready to use it. So you would do that by turning on the top button, which is the brush button, and going around your whole mouth for the first minute and a half. When you're done with that, then you would turn on the floss button, the second button, and go back around your entire mouth for the last 30 seconds.
Let me catch back up to my slides. So the pros and the cons of the Waterpik Sonic Fusion. Well, let's see if I'm not getting my picture back up on there, but we'll talk about the pros and the cons of the Waterpik Sonic Fusion. It works great. It's messy. And you have the potential of messing up your gums with this one as well too. The first thing that she mentioned is when you're setting up the Waterpik Sonic Fusion, there's a dial on the right side. You want that dial to be turned to 1 or 2, not really any higher. And then when I use this too in my own office or my own house. I fill it up just like she said, half with water, and then I add a mouthwash that I like the flavor of. So you could use something that's antimicrobial, like we use in the office after surgery, that Smart Mouth product. It works great, by the way. Or you can just use something you really like. I like Scope. I think Scope tastes great. So you can mix a couple of caps of Scope in there as well. And then leave it on setting 2, and then brush your teeth. And this toothbrush has a timer. So every 30 seconds, you're going to hear it pause. And after it pauses, you move to the next. And the way I use it personally, and I'm just going to sit back here and grab it. The way I use it personally is I'll go all of my outer teeth, and I'll hear the first pause.
I can't see you.
Oh, I can't see me. How do I switch that back? Let's see. Okay. Now, let's get back to my slides. Well, I'll have to go back and forth to the slides. I'm not sure how to make them come back on that partial screen again. Let's see. Let me try one more thing here. Slides. Select. Nope. There we go. Okay. So when I'm using this personally, I'll the first 30 seconds, I'm brushing the outsides of my teeth. And then I hear that pause, and I'll place it on the insides of my teeth, and I'll go all the way around again and wait until it pauses again. So that's a minute. And then I tend to brush everything one more time until I hear that third pause. And then finally I hit this button, the bottom button right here, and the water starts coming out of the bristles. So all this time, the first minute and a half, it's just been on the sonic motion. And then when I hit the bottom button, the water starts coming out of the bristles. And so I brush all my teeth again with the bristles, with the water coming out, and I hold it perpendicular to my teeth. And like, again, I was saying, I leave it on setting 2 on my own personal unit. If you're having a difficulty with recurring infections, another great advantage of using this type of device is using a rinse like this. This is called IO rinse, and it's got an iodide, not iodine, but iodide compound in it. And you can mix a cap full of this into your water, and it's going to irrigate that iodide compound into your gums. And if you're not allergic to shrimp or iodine, this is a great approach for managing patients who have recurring infections. So maybe you're noticing that you've gone through all this treatment, but you're starting to get 1 or 2 spots in your mouth that are having bleeding. Adding this to the regimen and to the water container on this works really good. And the iodine is really an effective antimicrobial. I would tell you that's answered the problem for a ton of patients. I see a question on here too. What is a good basic daily routine for preventing gum inflammation? And it's using this device twice a day. I would recommend using it right after you get up in the morning, you eat breakfast, then you use this. And then personally, after I eat lunch, I brush my teeth again. Now, I don't have this at work with me, so I typically just use a soft toothbrush at work that we have stored here. And then at night, right before I go to bed, I brush my teeth with the Waterpik Sonic Fusion again, just the same way that we showed you the first time. Do I floss? Well, I do. So I'm kind of, however you want to say, very, very detail oriented. So at night, right before I go to bed, I still floss. And let's talk about about some of these other gadgets that we have, and we'll talk about floss too. So the first thing on floss I want to show you is how much I use. And I personally like the brand Glide. I think all the flosses are pretty much equal, but if you've got tight contacts between your teeth, this stuff gets between the tight contacts really well. And I tend to be pretty wasteful when I use it. I use a big strand of it. and I'll just pull it out, wrap it around 2 fingers on one side, 2 fingers on the other side, and then I'll floss each and every tooth. And just in the photos that you see on the right side, when you're flossing up between your teeth, again, just like you didn't want to use a toothbrush with a saw motion, you don't want to use floss with a saw motion either. You just want to go up and down between the teeth, up and down. And when I'm doing it, like say I'm going between my 2 front teeth, I pop it between my teeth, and then I make kind of a C on one tooth and then a C on the next tooth, and I go up and down, and then I pop it and go to the next one. And then I tend to rotate the floss around my fingers. And I do that all the way around. I don't find it takes very long. I can typically floss all my teeth in under a minute, and then I'll rinse with a mouthwash typically, or water, one of the two. But same thing with your implants. When you're flossing, just the way you'd floss teeth, you floss implants the same way. You take care of implants the same way you take care of your natural teeth. Brushing and flossing, this combination is a very effective long-term approach. Also, please don't hesitate. If you've got questions, please throw the questions in there and I'll answer. One of the questions I just now see is, do you recommend any rinses or anything else to kill germs in order to prevent gum disease? And I do. I like the IO rinses right after surgery. And if you have recurring problems, I like the IO rinses. And if you're curious about how to get those, call us and we'll help you get connected. The other product that's really good on the market is this Smart Mouth toothpaste and mouth rinse. It comes in a kit. You can buy these kits at the supermarket too. I've seen them at Kroger and other places, Walmart. I've seen them there as well. So I know you can buy them just about anywhere. They've got a pretty effective combination, a chlorine dioxide type of compound in there that breaks up sulfur compounds, which kills bacteria very effectively. It has zinc. It has other components in it that are very effective, and it's not super abrasive. Let's talk about the abrasiveness a little bit. Some toothpaste, if you were to get Consumer Reports and go look up their papers on toothpaste abrasivity, turns out some are a lot more abrasive than others. And while that's not a problem just 1 or 2 times, over the course of a lifetime, using a really abrasive toothpaste can wear the enamel off your teeth. And for, after 10, 20, 30, 40, 50 years plus, using an abrasive paste like that, it makes your teeth yellow. For one, they won't look as good because you're abrading off the enamel. And 2, it just wears the teeth more than you need to. From my perspective, I think Colgate is a really great toothbrush. Smart Mouth is a great toothpaste. I tend to avoid the tartar control products. Some patients will start getting allergic type reactions to tartar control products. And so for me, I would stick with regular Colgate, or you can use a sensitive toothpaste as well. But I'd stay away from the super abrasive ones. One that's more abrasive than I thought it would be based on the Consumer Reports was Crest. I would have never guessed that Crest was so abrasive, but according to Consumer Reports, it was at the top of the heap as far as being abrasive around your teeth. Another product that you can use is called Superfloss. Superfloss is just a thick, fuzzy floss. So if you have some spaces between your teeth, it's got a thicker end, and it works pretty effectively. I'm going to try to plan a video on Superfloss. Let's see if I don't mess this up. Interproximal, sonic fusion. I think that's what we're using this for. Let's try it. That's just a really quick video, but it's just a thicker floss. And so if you typically have spaces between your teeth, using a thicker floss is helpful. Let's go to the next one. Myths about flossing. Flossings can push the gum up. So I've heard people tell me, well, I don't use floss because I think flossing can cause gum recession, and that's true to an extent. If you floss so hard that and you use a saw motion, so you're going back and forth like a sawing a tree again. If you look closely in the mirror and you see little lines in your gums, like you're cutting your gums, you probably are. So you want to take, when you're flossing, you want to push the floss up past the interproximal contacts until it just touches the gum. But you don't want to saw on the gum and you don't want to push the gum up. Another question I get a lot is oil pulling. How effective is oil pulling? And it could be used like using it like a mouthwash, like a rinse. So if you wanted to do oil pulling, I will tell you that the data behind oil pulling is all anecdotal. It's people saying I did it and it worked, but you're not really going to find any research studies that show that it's very effective. And in fact, dental schools have been investigating oil pulling to see if it was effective for gum treatment for patients that had gum disease. It wasn't really, unfortunately, but it could still be used as a rinse. So basically, you're taking a coconut oil or olive oil, and you're just, pushing it between your teeth. And that way, if you were to brush first, floss, and then oil pull afterwards, you'd be using it like a rinse, and it would be fine. It wouldn't have any negatives about using it in that fashion. I will tell you, I've had patients who had gum disease that thought that they could cure their gum disease with oil pulling, and they ended up losing teeth before they finally came back and sought out treatment. So oil pulling it's not really an effective gum disease treatment. The other, let's see. Oh, these are just facts about flossing. And there's been, I got to tell you, there's just decades of studies behind flossing that shows that it worked. So I highly recommend it. Interproximal brushes, in-tufted brushes. I would tell you there's tons of these on the market today. One of these is, this is called a soft pick. You can get these at pretty much in any, Walgreens, CVS, you name it. Everybody sells these soft picks. And I like soft picks a lot. They really are soft. You can get in between the teeth. You can use it like a toothpick. There's other products that are similar to that look like this. We have these at the office, and you can buy these at pharmacies as well. Pros and cons of using a pick. Because it does, you are pushing it between the teeth, and it's thicker than floss. And so if you already have some space between your teeth, you've got some black triangles when you look in the mirror, a floss pick can be very effective at cleaning out spaces like that. If you don't have any gum recession, a floss pick, these types of soft picks, interproximal brushes, they can actually cause your papilla to blunt, and you can actually create spaces between your teeth using these types of devices. So if you've already got spaces between your teeth, I'm saying, well, great, use them. They're fast, they're easy, they're effective. You can take them in your purse or put them in your car, your pocket, whatever, and use them on the go. But if you don't have any recession between your teeth, using a product like this could actually promote some recession. So I'm not a big fan of them if you don't already have it. Same thing with an in-tufted brush. These in-tufted brushes can be really effective, especially say that you've had lots of dental work over the course of years and you've got bridges. I've found that bridges, these in-tufted brushes, are pretty effective at cleaning underneath bridges. And so I'm a big fan of them for that as well. Again, you don't want to force it in between your teeth if you've already got papilla right there, because you can actually push down the papilla. So using like this, if you've already got some recession, or if you've had a bunch of crown and bridge work in the past, you may already have some gaps between that crown and bridge work anyway. An in-tufted brush comes in really effective. It comes in handy. And that's just a picture of us using it in between. I like the soft picks brushes just because they are pretty effective and they don't seem to hurt. But again, not if you already have any type of only if you already have recession. I tend to lean more towards using it for that. Tongue scrapers. So this is actually a pretty good device. Let's see if I have one on my tray here. I don't see one behind me. I don't. But a tongue scraper is basically it's like a little paddle, and you can scrape the top of your tongue with it gently, and it will really help with some patients that have bad breath. The back of your tongue, especially if you've got dry mouth. So say that you're taking medications for blood pressure. Just about every blood pressure medication I'm aware of causes dry mouth. Same thing for arthritic medications. They can weaken your immune system, and you tend to build up a white layer on the back of your tongue. So using a tongue scraper comes in really handy. And how I use it in my own practice. Oh, tongue scraper. Thank you. So this is a tongue scraper. And I tend to recommend putting a gel on it. We have a gel here in the office called OxyFresh gel. And it's a clear gel that you can just put a little ribbon on there and gently brush the top of your tongue with it. It'll clean the top of your tongue, and the gel will leave kind of a barrier on your tongue that'll kill bacteria for many hours after you finish using it. So if you feel like you've had a problem with bad breath, tongue scrapers come in really handy. Or if you've had like I said, you're taking some type of biologic that weakens your immune system, you tend to be more prone to develop candida. And so if you look in the mirror and you stick your tongue out and you see a white thick layer on the surface of your tongue, that can be candida, or it's a fungus basically. And a tongue scraper can be really handy for that. But I don't tend to use them dry. I like them with a gel, because it kind of lubricates your tongue, prevents you from abrading your tongue. You can overuse this device. Use it too much and start getting a rash on your tongue because you're doing it too hard. And using some type of lubricant over the top would help. You could also use an oil. So if you're into the oil pulling, or you just wanted to try something like that, you could use some coconut oil or olive oil on the top of that and lubricate it, and then brush the surface of your tongue. That would be just fine too. So my gum disease has been cured. And I got to tell you, what we do is we restore what's been destroyed when you have gum disease, but we haven't really cured anybody. So the bacteria that causes gum disease has evolved in your mouth over time. Within 15 minutes of when you were born, when you were a baby, you started to develop an oral flora. And for most of your life, that oral flora was protective. So it's what we call gram-positive, and it's aerobic. And it's these bacteria that aren't very motile. They don't move much. So they colonize the surface of your tongue. They colonize your teeth. They colonize your gums. And when pathogens try to come into your mouth, they don't have anywhere to land because your bacteria is coating everything. And even if they can land somewhere, they don't have anything to eat because your bacteria is eating up all the food, and your bacteria are healthy. But if you're fortunate enough to live long enough, over time, that flora in your mouth can start to harbor pathogenic bacteria. And so these bacteria, they don't breathe air, they breathe CO2. And now they can swim, they can move from one place to another. And so once they start getting underneath your gum, that's what causes gum disease. Your immune system hates these bacteria, these gram-negative anaerobic mobile bacteria. And as they start growing underneath your gums, your immune system starts to attack them. It creates bleeding gums, red, irritated gums. If this process keeps going on long enough, the bone around your teeth starts getting damaged. That's the reason you need to have your teeth professionally cleaned. If you've had gum disease in the past, you need to have your teeth cleaned on a 3-month schedule, because it takes 3 weeks for bacteria to get underneath the gum, and it takes 3 months for that bacteria to grow enough to actually cause any bone loss around your teeth. So if you haven't ever had gum disease before and you don't have any bone loss, having your teeth cleaned every 6 months is fine. But the 3-month cleaning is always going to be recommended once you've ever had any type of gum disease. So the pathogenic bacteria, this bad part of the flora, they live in the back of your mouth. They live in your tonsils. They live in the pits of your tongue. And so you can't honestly perfectly clean them away. And that's the reason you need to have a professional cleaning every 3 months. I've got a question. Is 3-month cleaning recommended? Again, yes, it is. 6 months, okay, as long as you don't have a past history of ever having gum disease. But once you have the flora that causes gum disease, you need to stay on a 3-month schedule. I would tell you, though, that even though you've had a history, or if you've had a history of gum disease, you can maintain your teeth for life. The studies I was telling you about at the beginning, there's a lot of studies that were done in Scandinavia, and they followed patients over 30 years after they had gum treatment. And the patients that routinely came back in for their cleanings and they followed through with good home care, they kept their teeth the rest of your life. In our practice, the statistics are interesting, and this is kind of just not our practice, but the United States as well. It turns out about 80% of patients, after they've had their gums treated, maintain their teeth long term. They come back for cleanings and they do a good oral home care. About 20% of the patients fall back into their old habits, not brushing and flossing after. So maybe they're doing it for the first half year, and then the second half year they get busy, or you're taking care of someone. You're taking care of someone in the hospital, or you're just whatever the pull is away from your normal routines, and the disease starts to come back. That's when you need to have your teeth cleaned again. And it's when you really need to stay on the 3-month schedule. Another interesting thing too about gum disease is it tends to hit you when you're under stress. So when your body produces cortisol, so you're under stress, you've moved from one house to the next, you've had a change in your job, you've got some kind of stress in your family. That's when your body produces more cortisol. That's when your gum disease tends to want to take off. So under those circumstances, again, make sure you're having your teeth cleaned on a 3-month basis. I got another question. It says, is there a particular type of tongue scraper or brand? Not really. I would tell you that we just find whatever's available and easy access. I haven't really found a big difference between any of them. Again, it's not so important which brand you use, but you use it with some type of lubricant, and you don't overly abrade your tongue. I've heard this from a ton of patients. I've lost my teeth, and now I've got dental implants, or I've lost some of my teeth and I have dental implants, and dental implants are more resistant to gum disease. That is so untrue. So God made you perfectly. And when we remove something that's God given, it's not as good as your original equipment. Your immune system will fight for your teeth. And that's why typically, in most cases of gum disease, it will take decades to lose your teeth due to gum disease. On the other hand, your implants are a foreign body that's placed in the mouth. They're made out of titanium because titanium is the only metal that your bone will actually chemically bond to. And it does, it chemically bonds to it. But if that metal becomes infected, your body will treat that implant like a thorn in the palm of your hand. It will do everything it can to get rid of it. And then that's what we see. So whereas gum disease around natural teeth can take a decade to progress, gum disease around an implant can take under a year. So once an implant starts to get infected, your immune system will detect that and do everything it can to get rid of that implant. And so again, if you've got dental implants, but you have a past history of gum disease, you need to have your implants as well as your natural teeth cleaned every 3 months. That's just so important. So implants can last a lifetime too. You know, I've been keeping statistics on the implants that we've placed since I started practice in 1991. And we're at a 3% failure rate for the course of our practice, which is an incredible failure rate. If you were to look in the dental literature, the failure rate in the United States is as high as 20%. So I think one of the reasons we've been so successful with dental implants over the course of our practice is one, before we place an implant, we make sure that the site where the implant's going to go is healthy enough. The gums are thick enough, the bone's thick enough, that type of thing. And two, we do emphasize maintenance after you've had the implants. Whether we're replacing one tooth or every tooth in your head with a teeth in a day type of approach, our focus is always how can we maintain you for the rest of your life? That's such an important way to look at things too, because in our cases too, we always have what I call our plan B, or a back door. If you do have, if we anticipate that you have dental work in your mouth that's going to fail in the future, we try to plan for that even in your initial treatment, so that as things change, we can adapt to it. So keep that in mind. And dental work can last a lifetime, but it has to be taken care of, and it has to be done right in the first place too. After we do a pinhole procedure or gum regeneration or something like that, where we're restoring your mouth back to the way it was before you lost tissue, we put you on an ultra soft toothbrush, and we only intend for you to use that for 2 to 3 weeks. And then after that, we want you to go back to a regular soft toothbrush. We'll give you the mouthwash we want you to use, which is basically the Smart Mouth, because it's got a good antimicrobial component to it. And it tends to stick to your gums. This is kind of a cool thing about Smart Mouth. It will stick to your teeth and your gums for 12 hours. So it'll kill bacteria for 12 hours. Whereas if you're using something like Listerine, Listerine only has an effect in your mouth for about 30 minutes. And then because it has alcohol in it, it tends to dry out your mouth and you overgrow bacteria. Toothpaste doesn't have alcohol in it, but most toothpaste only has that initial impact of cleaning your teeth. It doesn't have any long-term residual impact like Smart Mouth does. So Smart Mouth is really a good product. And then after we've treated you, again, back to that 3-month recall, it's just so important. On our webpage, and I put that at the top of this slide, it covers this topic and so many more. But if you would please, I'd really appreciate if there's any other particular topics you wish that I would cover. We're going to start doing these routinely. We're learning the software, as you might can tell from this webinar, but we'll get better with it as time goes on. And as we get better with it, I'll cover any topics that you have questions about. So if there's something you want me to cover in future webinars, please add it to the chat session or the questions, either one. And I'll make sure that we address it as with time. And if there's any specific questions you've got right now about anything I've covered today, please type them in and I'll address them right now. But I thank you so much for being part of our initial webinar. It's been fun doing this, and I think we're going to do a lot more of these. And I'd appreciate any and all feedback that you have, whether it's the lighting or how loud the microphone is or isn't, or even the video, even my background. Even though you've got Dino on my background, I'd appreciate any and all comments. Thank you so much. And like I said, if you have any questions, please, you can go to our website and contact me through the website. You can call us. I really appreciate it. Thank you so much.